Welcome back, everyone. We're diving into a topic that, well, the older we get, the more we should probably think about it. High blood pressure, specifically in older adults. And our guide for this deep dive is the National Initiative for Care of the Elderly in Canada. They're doing some really great work to make life better for seniors. So by the end of this, hopefully, you'll have a better understanding of how to manage your own health or, help your loved ones do the same.
It's something that a lot of people kind of have, I think, a simplified view of, and I think there's a lot more to it. So I'm really looking forward to unpacking all of that with you.
Me too. Before we get too far into it, let's just make sure we're all on the same page. What exactly is high blood pressure?
So think about it this way. Your arteries, they're like the highways of your body, right? They transport blood everywhere. And high blood pressure or hypertension, it's basically like constant rush hour traffic in those highways. So the force of the blood against the artery walls, it's just consistently too high. And that's not just like a temporary inconvenience. It can have some pretty serious long-term effects on your health.
Yeah, it's like wear and tear on your internal infrastructure.
Yeah.
I've always heard it called the silent killer. Why is that?
That's a great point. Yeah, because a lot of times there aren't any noticeable symptoms,
Yeah.
especially in the early stages. You could feel totally fine, but damage could be happening behind the scenes, so to speak, and that's why regular checkups are so important. The earlier you catch it, the better, especially as we get older.
Okay, that makes sense. So speaking of catching it, let's talk about those blood pressure readings. When I see numbers like 115 over 76, what am I actually looking at there?
Okay, great question. That's actually a really good example of like healthy blood pressure reading. So let's
Nice.
break it down. The top number, the 115, that's your systolic pressure. And that represents the pressure in your arteries when your heart beats. So your heart's contracting, pushing the blood out. It's like the peak force during that heartbeat.
Okay, so that's the peak pressure. What about the bottom number?
The bottom number, the 76 in that example, is your diastolic pressure. And that measures the pressure in your arteries between beats. So when your heart is relaxed and refilling with blood, you can think of it as the baseline pressure. And both numbers are important because they give us a complete picture of, well, of how hard your heart is working and the strain on your arteries.
So it's not just one number being high or low, it's the relationship between the two.
Exactly, exactly. And to kind of make sense of those numbers, we use these risk categories, right? So anything below 120 over 80 is considered low risk. Medium risk would be between 121 over 80 to 134 over 84. And then anything above 135 over 85, that puts you in the high risk category. And that's where the potential for complications really starts to increase.
Gotcha. Now, more and more people are using those home blood pressure monitors these days. Is that something you recommend?
I think home monitoring can be really valuable, but there's definitely a right way and a wrong way to do it. I talk to so many people who aren't getting the most accurate readings, and that can be more misleading than helpful. So the first thing is you've got to have a reliable monitor.
Okay, so how do we know which ones are good? Any tips for like navigating all the choices out there?
Absolutely. Actually, the Hypertension Canada website, they have a list of validated devices, so that's a great place to start. But even with a good monitor, technique matters a lot. Things like arm position, posture, even, having a full bladder can skew the results.
Oh, wow. I know I've definitely been guilty of rushing through it before. So what are some like best practices to make sure I'm getting accurate readings at home?
Yeah, I'm glad you asked that because honestly, this is where a lot of people go wrong. First off, avoid exercise, caffeine, smoking, alcohol, at least 30 minutes before you take your reading. Make sure you're sitting comfortably with your back supported, feet flat on the floor. Your arms should be resting on a surface so your elbows level with your heart. And this might sound silly, but an empty bladder can make a difference too.
Okay, so it's all about creating a calm and consistent environment.
Yeah, exactly. Take at least two readings about a minute apart and average them. And if they're significantly different, take a third one and average all three. It's important to remember that blood pressure naturally fluctuates throughout the day, too. It's usually highest in the evenings and lowest in the mornings. So consistency and timing is key. If you usually measure in the morning, stick with that.
Okay, that makes sense. So we all know that age is a big factor when it comes to high blood pressure. But what are some of the less obvious risk factors that people might not be aware of?
That's a great question because it's not always just about getting older. Family history plays a huge role. If you have close relatives with high blood pressure, heart disease, diabetes, your risk goes up. Certain medical conditions can tip the scales too. Things like metabolic syndrome, which is actually a cluster of conditions, increased blood pressure, high blood sugar, excess body fat around the waist, abnormal cholesterol levels.
Wow, that's a lot.
Yeah, it is. There are other conditions like chronic kidney disease, sleep apnea, thyroid disease. Those can all increase your risk too. And of course, we can't forget about lifestyle choices. Things like being overweight, lack of exercise, a diet high in sodium, smoking, excessive alcohol consumption, even chronic stress. All of those can significantly impact your blood pressure.
So it's really about understanding your own unique risk profile, not just your age. It sounds like we have a lot more control over this than we might realize.
Absolutely. I mean, that's one of the things I find so fascinating about this topic. We tend to think of high blood pressure as this inevitable consequence of aging, but there's actually so much we can do to influence our risk and manage our health proactively.
All right, so this is what I love to dig in. Let's talk about those proactive steps. What kind of lifestyle changes can really make a difference when it comes to blood pressure?
Well, this is where things start to get empowering, I think. Even small changes can make a big difference over time, and you don't have to completely overhaul your life overnight. Start with manageable steps that you can realistically incorporate into your routine. Even something as simple as 10 minutes of brisk walking each day. Studies show that can significantly reduce your risk of developing hypertension.
Okay, I love that. Small steps, big impact. What about diet?
Diet's huge, obviously. It's not about deprivation, though. It's about making smart choices. Think about it this way. Every time you eat, you're either feeding disease or fighting it. So load up on fruits, vegetables, whole grains, lean protein. Those foods are packed with nutrients that support healthy blood pressure and overall well-being. And don't forget to keep an eye on your sodium intake, too.
Right, the salt. I've heard it's not just about the salt shaker at the table.
Exactly. It's often hiding in plain sight. Processed foods, canned soups, restaurant meals, they can be loaded with sodium without you even realizing it. Learning to read food labels and choosing lower sodium options can make a big difference.
So it's like being a detective at the grocery store.
I like that.
Right.
Now, two other big ones we need to talk about are smoking and alcohol.
I have a feeling I know where this is going, but let's hear it.
You probably do, but it's always worth repeating. Quitting smoking is hands down one of the most impactful things you can do for your heart health, and it has a direct effect on blood pressure. As for alcohol, moderation is key. Stick to the recommended guidelines, and if you don't drink, there's no need to start.
Now, what about stress? It feels like everyone's dealing with chronic stress these days.
Oh, absolutely. Stress is a huge factor that often gets overlooked. When we're constantly stressed, our bodies are in this fight or flight mode, releasing hormones that raise blood pressure. So finding healthy ways to manage that stress is crucial. Things like exercise, meditation, spending time in nature, even just taking a few minutes each day to breathe deeply and quiet your mind. All of that can make a world of difference.
It's like building resilience from the inside out.
Exactly. It's about giving your body the tools it needs to cope with the inevitable stressors of life. Now, we've been talking a lot about lifestyle changes, which are foundational, of course, but sometimes they're not enough to manage high blood pressure on their own, and that's where medication might come into play.
Right. And it's important to emphasize that we're not medical professionals. This is definitely where a conversation with your doctor is essential.
Oh, absolutely. But I do think it's helpful to have at least a basic understanding of how these medications work. It can make those conversations with your doctor more informed and empowering.
I agree. So can you give us a simplified overview of the common types of blood pressure medications?
Sure. There are several different classes, each working in slightly different ways. Some, like diuretics, help your body get rid of excess fluid, which can lower blood pressure. Others, like ACE inhibitors, work by blocking the production of a hormone that narrows blood vessels, and that leads to a reduction in blood pressure.
So different medications, different mechanisms of action, but all aimed at lowering blood pressure through various pathways.
Precisely. And it's important to remember that finding the right medication and dosage, it's a very individualized process. What works for one person might not work for another. And there can be side effects to consider. So that's why working closely with your doctor is so crucial to find the best treatment plan for you.
It's like finding the right key for a specific lock.
Perfect analogy. Now let's shift gears a bit and talk specifically about older adults. Is there anything unique about high blood pressure in this age group?
Well, I know we touched on isolated systolic hypertension earlier. Is that what you're referring to?
That's one of the key things, yeah. Older adults, particularly those over 75, they often experience this type of hypertension, where the top number, the systolic pressure, is high, but the bottom number, the diastolic, is normal.
We talked about systolic being that pressure when the heart beats. Why would that number be specifically elevated in older adults?
It's mainly due to the stiffening of the major arteries as we age. Imagine, like, an old garden hose that's lost its flexibility. It takes more pressure to push the same amount of water through.
Okay, I can picture that. So is isolated systolic hypertension still a cause for concern, even if the diastolic pressure is normal?
Absolutely. It's still linked to serious health issues like stroke and heart disease. In fact, some studies suggest that it might be even more dangerous than combined systolic and diastolic hypertension. In older adults, that is.
Wow, I didn't realize that. So what are some symptoms that older adults might experience with isolated systolic hypertension?
Well, remember, it's often called the silent killer. So many people don't have noticeable symptoms, at least in the early stages. However, as it progresses, some older adults might experience shortness of breath, dizziness, especially when standing up quickly, and an increased risk of falls.
So it's particularly tricky because those symptoms could easily be attributed to other things related to aging.
Exactly. That's why it's so crucial to have those regular checkups. Be aware of any changes in your health, no matter how small they might seem. And if you're caring for an older loved one, be mindful of those subtle signs. Encourage them to talk to their doctor.
It all points back to the importance of early detection and intervention.
Couldn't agree more. And that brings us to another interesting point. Treatment approaches for isolated systolic hypertension, they might differ from other types of high blood pressure. And there's a lot of ongoing research in this area.
Oh, interesting. What's the latest thinking on that? What should people be aware of?
Well, recent research suggests that the target systolic blood pressure for older adults, it might need to be adjusted based on individual health and frailty. The traditional target of below 140 over 90, it might not be appropriate for everyone. Some older adults might benefit from a slightly higher target, while others might need to aim lower.
So it's not a one-size-fits-all approach,
Hmm.
especially when it comes to older adults.
That's the key takeaway, for sure. It's about personalized medicine, taking into account the individual's overall health, functional status, risk tolerance. This is where working closely with your doctor and having open communication about your goals and concerns is so important.
This has been so insightful. I'm already thinking about things I can do differently in my own life.
That's what we like to hear. Knowledge is power, and even small changes can have a big impact on your health.
I completely agree. Before we wrap up, I'd love to get your take on something I've heard some people say. That white coat hypertension, that spike in blood pressure some people get at the doctor's office, it's not a real concern. What are your thoughts on that?
That's a great question, and one that comes up a lot. While it's true that some people just get anxious in medical settings, which can lead to a temporary spike in blood pressure, I wouldn't dismiss white coat hypertension as nothing to worry about.
Mm-hmm.
Research actually suggests that it might be an early warning sign of underlying cardiovascular risk.
So it's like our bodies are trying to give us a little nudge like, hey, pay attention to this.
Exactly. It's a signal that something might be off balance, even if your blood pressure readings are normal in other settings. I always encourage my patients who experience white coat hypertension to monitor their blood pressure at home and work on stress management techniques.
Yeah. That makes a lot of sense. Well, this has been an incredibly eye-opening deep dive. We've learned so much about high blood pressure in older adults, thanks to the National Initiative for Care of the Elderly in Canada.
It's amazing how much research and information is out there. And hopefully our listeners are feeling empowered to take charge of their heart health.
Absolutely.
Yeah.
So to bring it all together, what are the key takeaways you want our listeners to walk away with today?
First and foremost, high blood pressure is serious, especially for older adults. But it's manageable, especially when you're armed with knowledge and proactive habits.
Right. Knowledge is power, as they
Exactly. Regular checkups are vital, even if you feel fine. Because remember, it's often called the silent killer. Don't underestimate the power of lifestyle changes either. Things like healthy eating, regular exercise, stress management, quitting smoking, moderating alcohol intake, those can make a world of difference. And if medication is necessary, work closely with your doctor to find the right treatment plan for you. There are effective options out there.
And for our listeners who are caring for older loved ones, be mindful of the signs of isolated systolic.
A little more empowered to really take charge of their heart health.
Absolutely. So, to wrap things up, what are the key takeaways you want our listeners to remember today?
Well, I think first and foremost, high blood pressure is serious, especially for older adults. But it is manageable, especially when you have knowledge and you're practicing those healthy habits.
Right. Knowledge is power, as they say.
Exactly. Regular checkups are so important, even if you feel fine. Because remember, it's called the silent killer for a reason.
Hmm.
And don't underestimate the power of those lifestyle changes we talked about. Healthy eating, regular exercise, managing your stress, quitting smoking, moderating alcohol. Those can make a world of difference. And then, if medication is necessary, work closely with your doctor to find the right treatment plan. There are effective options out there.
And for those listeners who are caring for older loved ones, just remember to be mindful of those signs of isolated systolic hypertension we discussed, and encourage them to talk to their doctor if they're experiencing any, well, any unusual symptoms.
Such a good point. Early detection and intervention are key.
Absolutely.
Yeah.
I think we've given everyone a lot to think about. So what's one small step you can make today to support your own healthy blood pressure? It could be as simple as taking a walk, swapping that sugary drink for a glass of water, or just taking a few minutes to breathe deeply and de-stress.
I love that. Small steps, big
Yeah.
impact, right? And for anyone who wants to learn even more, we highly recommend checking out the National Initiative for Care of the Elderly website. They have a ton of fantastic resources for older adults and their caregivers.
Great advice. And until next time, keep diving deep, everyone. Stay curious, stay informed,
Yeah.
and most importantly, take good care of yourselves